Hi guys, welcome back to Skincare Sunday. Dr. L here, filming in Los Angeles today. I wanted to talk to you guys about a super common issue I see all the time in my patients. It's hormonal acne. Also, adult onset acne is another name for it. It is super common, the 20s, 30s, 40s, even early 50s. It tends to be clustered around the jawline area, kind of perioral area. Happens to get worse the week before your period, but can be kind of ongoing throughout the month, but definitely gets worse that week before your period. So we're going to talk about why it's becoming more common, what causes it, and what are the steps you can take to take control of hormonal acne before it has a chance to scar you. I struggled with hormonal acne throughout most of my 20s and 30s, and finally I have control of it, and it does not any longer cause me to break out the week before my period, so my period does not ruin my skin anymore. All right, so what is adult onset or hormonal type acne? Once again, it doesn't have to be the week before your period that you experience these types of breakouts. Most women that experience these are noticing painful, sometimes cystic lesions around the mouth, here, this area, sometimes along the under the cheekbone area. They do tend to cluster before your period, but they can be present throughout your cycle. They tend to get worse and more common before the week before the period. And what it is a combination of dead skin buildup, which is happening as we age. So sometimes hormonal acne gets actually a little bit worse in the 30s and 40s because that skin cell turnover cycle is slowing down. So we have more dead skin building, more pore clogging. And it has to do with oil production as well. So the week before your period, the hormonal changes causing more oil production causes breakouts. So how do we not let our period destroy our skin? So it means taking control of those two processes, taking control of that oil production, more so the week before your period, and tailoring your skincare to that week, more so, but throughout your monthly cycle as well, and taking care of that skin cell turnover cycle. So when we're not building a bunch of dead skin cells over that oil, causing that clogged pore or that breakout before your period or that cystic buildup along the jawline. So let's talk about strategies to control the oil, to exfoliate the dead skin so that we can avoid breakouts. Because once you break out, it's too late. You're gonna have a cyst come to the surface. It's gotta come to the surface. So initially, sometimes when we start strategies to treat hormonal acne, it gets worse before it gets better because we gotta purge all those clogged pores from previous buildups of dead skin and oil. So purging is a common thing that happens when you start treating hormonal acne. I see it all the time. You have to dry out your skin, you have to reduce oil production, you have to exfoliate that dead skin buildup. So you're gonna be peeling. Sorry guys. So the tools that you wanna start with is a customized skincare regimen that is medical grade, that is going to control the oil, exfoliate the dead skin. So we actually have some amazing new tools from ZO. Our retinol with acne complex is unbelievable for hormonal acne. Not only is it the most powerful 1% retinol from ZO so far for acne, but it also has a complex of other ingredients that are going to control not just the acne and prevent breakouts, but also the complications from that acne, including hyperpigmentation or dark spots, the redness and inflammation that comes when we get an acne zit. So this is an amazing new product for our hormonal acne patients. So start your skincare regimen with a good acne controlling cleanser, an acne controlling exfoliant, and toner. So my favorites for these are the exfoliating cleanser, the dual action scrub, and the oil control pads. And I do alternate these throughout the month because right after my period, which is the beginning of your cycle, you'll be the least oily. After your period, I tend to go back to my gentle cleanser. I tend to go back to my polish, my complexion renewal pads. But the week or 2 weeks before my period, I ramp back up on controlling oil because that progesterone comes in. And now I'm more oily and I'm gonna break out if I don't control it. So start with your getting skin ready steps and tweaking those. And then your topicals to control the oil, like this new retinol, as well as exfoliation accelerator. And also masking is a great strategy to control oil a week or two before your period. All right, I'm going to talk all about the sulfur mask next week at Skincare Sunday because I know I'm going to get asked a lot of questions about that product. And I absolutely love it to control oil production before your period comes. Take that oil out of the skin, mask it out, pull it out before it breaks you out. Prevention is key when it comes to acne, preventing scarring, preventing complications long-term in the skin. Anyway, so delving into the first 2 weeks of your cycle, which begins the first day of your period, are when your skin is the least oily. Now, if you're oily, like I have just oily skin, period, you can develop acne anytime. Blackheads are there all the time, things like that. It just tends to get worse after your mid-cycle. So around day 14 onwards, oil starts to build as that progesterone goes up, and now you're breaking out. So prevention is key, decreasing the oil out of the skin. So for some people, skincare alone is not enough, especially if you're getting used to your skincare. And I think you guys know that after a while, our skin will adapt to products. So you always want to be switching up your products as well as getting a treatment of some sort, like a deep cleaning. And I love to do facials like Diamond Glow or Hydrofacial the week before my period because I want that excess oil that's building to be removed, again, preventing the pore clogging from happening in our skin. Other treatments available for hormonal acne in our office are BBL for acne. And I love this treatment if you have cystic hormonal acne, the type that also can cause scarring and discoloration and tons of redness. The BBL wavelengths during this treatment are designed for really going after that cystic type acne that can happen around the jawline. And it can also help with the scarring. So if you've done skincare and treatments and you're still struggling, there's also oral medications that can really help control that internal hormonal driver of your acne. And it's typically needed when we have big cystic hormonal acne that hurts. It means that the oil production from your hormones is really above and beyond what skincare and facials can do. So if you need orals, we definitely do some oral medications for hormonal acne in our office. It would be after consultation and combined for best results with skincare and treatments as well. Now, if you've had hormonal acne for a while and you have discoloration, darkness around the jawline, I personally had a lot of darkness right here because I used to pick. Don't pick. Hormonal acne is very tempting because it hurts. And the temptation to pick is got to be done. You cannot do it. You will discolor, and it's so hard to treat that type of discoloration here, believe me, from my experience. But if you have scarring, first step is to control the acne. Once the acne is controlled, then we have tons of options for treating the discoloration, the pitting, whatever type of scarring you have. There's lots of options. There's more options in our office than ever before. Some of them are with me, some of them are with my nurses with device-based treatments, microneedling, subcision. Some of the deeper scars may need actually some filler. I also love Sculptra if you're having some signs of aging or you want to be proactive about aging. Sculptra can actually improve some of the scars, the superficial scars. So lots of options to treat scarring, getting the acne under control first, getting on a good regimen, and then we treat scarring. All right, that is all for Skincare Sunday. If you've struggled with hormonal acne for a while and you at the point of frustration, I totally understand your pain. It literally took me years to get mine under control. Like probably the last year I've had cycles without acne. And that to me is like unbelievable because I've struggled for my entire lifetime. So there is a way to get control of it. It is going to be a journey, and there might be some things getting worse before they get better. But as long as you're staying on track and you're taking care of your skin, there's definitely light at the end of the tunnel, and you can really enjoy beautiful, healthy skin and get after that scarring if you've had some as well.